Hello everyone. Today we'll be looking at questions and answers in tooth morphology, and this series is looking at tooth morphology and specifically anterior teeth. So the first question is, where can the interdental papillae be found? So the interdental papillae can either be found in the posterior surface of the tongue, on the hard palate, cervical to the proximal contact, or adjacent to the foveae palatinae. So the right answer, the interdental papillae can usually be found cervical to the proximal contact. So if this is the proximal contact of the teeth, so it is cervical. So this triangular area shown by this pink gum is filling the interdental void or the interproximal space of the cervical embrasure. And it is cervical to the contact. So the next question is, name the widest anterior tooth. So the widest anterior tooth is maxillary permanent central incisor. Not only is it the widest tooth in terms of mesodistal dimensions, and it measures around 8.5 millimeters in mesodistal dimension, but its mesodistal dimensions are actually greater than its faciolingual dimensions. The question is, name the narrowest anterior tooth. So the narrowest anterior tooth in the permanent as well as the deciduous mandibular lateral incisor. Not only is it the narrowest anterior tooth in the deciduous dentition, but it measures around 4.1 millimeter in the mesodistal dimension. In terms of the permanent dentition, the mandibular central incisor is considered to be the narrowest anterior tooth, and not only is it the narrowest anterior tooth, but it is also the most symmetrical. So now the question is, which of the incisor class of teeth has the most prominent marginal ridges? So the most prominent ridges in the anterior teeth belongs to the permanent maxillary lateral incisor, and this is the only tooth that has not only has it prominent marginal ridges, but there are certain landmarks that are specific to the maxillary lateral incisor, and these are that not only it has very prominent striae of Retzius, and as well as there sometimes there's a groove, the palatolenticular groove, which is found on the just below the cingulum on the lingual aspect. So now the question is, which of the incisor class of teeth has the most well-developed middle developmental lobe? We're talking about incisor teeth with the most well-developed middle developmental. So permanent maxillary lateral incisor has the most well-developed middle developmental lobe in terms of incisors. If we talk about all of the teeth altogether, including incisors, then the canine has the most prominent middle developmental lobe, and that is why its labial ridge is very prominent. So now the question is, name the set and arch of the incisor class of teeth that exhibit poorly developed marginal ridges and a less prominent cingulum and a very inconspicuous lingual fossa. So the answer, the mandibular permanent incisors, be it the mandibular central, be it the mandibular lateral incisor, they have poorly developed marginal ridges, and their cingulum is not as well developed as the other teeth. In the lingual fossa is also less prominent. So the question is, name the tooth which is, when viewed from the labial or the facial aspect, has mesial and distal crests of convexity or crest of curvatures that are found incisally placed in the incisal third of the crown. And these are the permanent mandibular central incisor. This is the only tooth in which the proximal contacts on both the mesial and distal, when found, are usually found incisally in the incisal third of the crown. That is why it is considered to be the most symmetrical tooth. So next question is, which of the incisor class of teeth has a distinct twisting of the incisal ridge relative to the root base of the tooth? And this is known as the distolingual twist. So the twist is usually found in the permanent mandibular lateral incisor. And this is a feature through which the permanent mandibular lateral incisor can be differentiated from all of the other incisors. And uh, this feature uh, is present because of the distinct tilt or twist of the incisal ridge relative to the root base. So thank you for listening. Keep on watching all other videos. Thank you.